Welcome to Pinoy Medical Coder. Today, we'll be discussing about prior authorizations. Before we begin, please don't forget to like our Facebook page and also like and subscribe to our YouTube channel. Importance of prior authorization is the procedure of obtaining prior approval from the payer, insurance company, before the healthcare provider offers services to the patient, also called prior approval or pre-certification. It is a confirmation by your health insurer that a healthcare service, treatment plan, prescription drug or durable medical equipment is medically necessary. It is not a guarantee that the cost will be covered though. It does not affect cash transactions for medications and procedures. It comes into play only when medical billing is done through insurance. The importance of prior authorization in RCM. Let us discuss in detail how critical the prior authorization process is, keeping in mind different scenarios. The prior authorization process is a very important phase of the revenue cycle management as payers need to confirm whether a particular medication or procedure will be approved. If the insurance firms do not approve certain procedures and medical equipment, healthcare providers should wait or contact the insurance providers for approval and then perform the necessary procedure. An unapproved or rejected authorization interrupts the patient treatment process due to unsanctioned procedures, missing patient information, or incomplete medical documentation. At the same time, disapproval can also be in the best interests of a patient owing to the cost, dangerous side effects, the efficacy of a drug, or whether there is a real requirement. For instance, a lung specialist may recommend a chest CT scan for a patient, but the same scan may have already been ordered by a heart specialist just a few weeks earlier. The insurer will not approve the procedure unless it is clear that the previous scan has already been reviewed and there is a need for an additional scan. If a patient has undergone physiotherapy for say, a month, and there is a recommendation for another 3 months of similar therapy, the insurance provider will first evaluate if the treatment has helped at all. If the patient response is positive, the extension will be approved. If not, the insurance company will not give an extension. In cases of emergency, certain procedures did not require prior authorization and are excluded, and in cases where treatment is done, retroactive authorization is requested by healthcare providers, pre-verification and prior authorization. First, patient schedule is received. Second, verification of benefits is carried out. Third, patient is told about their financial obligation. Fourth, benefit information is updated in system. Fifth, schedule is verified by pre-authorization team. Sixth, pre-authorization is obtained from care management. Seventh, the schedule is reported to the physician's office and confirmed. Lastly, the patient receives the service. Some advantages of prior authorization are: reduction of denials and enhanced collections, reduction in write-offs, helping the patient know their financial obligation. Healthcare providers can focus on patients. Accountability and cost containment. Ensure seamless prior authorization. Healthcare providers invariably face problems in the prior authorization procedure. The following are some best practices to avoid major disruptions in the prior authorization process. Right handling of ICD codes and procedural coding is vital. The person who handles billing entry has to select the correct codes. Constant communication between the provider and payer is crucial. The provider should ensure constant communication with the insurance provider. Provide detailed documentation to obtain pre-authorization and follow up regularly. Inform insurers about emergency patient admissions. Integrate pre-registration data with the prior authorization method. As patient information is collected prior to appointment scheduling, it will streamline the prior authorization process. What if prior authorization is not obtained? In situations where pre-authorization is not granted, the payer policies determine who bears the cost. Some health plans fix the responsibility on the patient, while others make the provider accountable. A few payers deny reimbursement if a patient undergoes a procedure without prior authorization. Insurance providers use exclusion lists to determine which medications and procedures are covered under the plan and which are not. As a result, patients are denied procedures. At times, this prompts them to switch to new treatment plans, in spite of what the doctor originally recommended. Many individuals think that as long as they have health insurance, their prescribed medication or treatment will be reimbursed. They are not aware of the new additions to exclusion lists until their payer informs them that procedure is no longer included. Example is a typical update to an inclusions or exclusions list. Procedures requiring prior authorization: CT, CTA, MR, MRA, PET scan, CCTA, myocardial perfusion imaging, megascan, echocardiography, stress echocardiography, cardiac catheterization, implantable cardiac devices. These procedures do not require pre-authorization or medical necessity review for members under 18 years. Excluded from program. Procedures performed in the following settings: hospital inpatient, observation, emergency room, urgency care facility. Remember, each payer has his own exclusion and inclusion list. Some payers may have procedures like selective, emergent, or urgent medical procedures, surgical inpatient admissions, skilled nursing facility services, inpatient rehabilitation procedures, subacute admission procedures, and transplants under inclusions. So they need prior authorization. Usually, expensive radiology services like ultrasounds, CAT scans, and MRIs require pre-authorization. However, procedures like the screening test, outpatient treatment, physical therapy, and initial evaluation did not require prior authorization. There is no prior authorization required for screening test for the first 12 visits or hours within a calendar year. Some medications are also not covered, hence, healthcare providers are advised not to prescribe or bill such drugs. What are retroactive authorizations? Retroactive authorizations are given when the patient is in a state, unconscious, where necessary medical information cannot be obtained for prior authorization. In such cases, many insurance providers require authorization for services within 14 days of services provided to the patient. These approval requests are called as retroactive authorizations. The provider submits the claims, and then the payer responds as per a standard set of guidelines, to reimburse the claims. Retroactive authorizations also come to the rescue when the healthcare provider does not have sufficient time to obtain prior authorization or when there is a denial based on medical necessity. Conclusion: even though prior authorization can lead to treatment delays and deprive patients of medical care, it is critical for healthcare providers to pursue prior authorization. Similarly, though patients may be burdened with a lot of documentation and long waiting periods, it is better to seek prior authorization in the interest of cost containment and to access the most suitable treatment. Thank you for watching.